Hello, my name is Vincent Xu. I'm a medical oncologist at Dana-Farber Cancer Institute. I'd like to talk to you today about the safety and tolerability outcomes from the CheckMate 9ER trial, which investigated cabozantinib and nivolumab and led to its approval as a standard frontline treatment option for metastatic renal cell carcinoma. As we know, cabozantinib and nivolumab received FDA approval as a combination therapy in the first-line setting based on improvement in progression-free survival and overall survival compared to sunitinib, and this was shown in CheckMate 9ER trial. However, what's equally important when thinking about treatment regimens is their toxicity profile and what side effects and treatment-related symptoms may be experienced by the patients. Not surprisingly, patients on both treatment arms had significant toxicity, and over 99% of patients on both sunitinib and cabozantinib and nivolumab had some sort of treatment-related adverse events or toxicity. However, when we think about the toxicity profile of cabo-nivo, we really think about the combination of a VEGFR TKI, cabozantinib, with an immune checkpoint inhibitor, nivolumab, and this regimen has the overlapping toxicities of both. When we think about the cabozantinib part, most common side effects related to this include diarrhea, hand-foot syndrome, high blood pressure, fluctuations in thyroid levels, fatigue, and moderate and elevated liver function tests, including AST and ALT, and sometimes bilirubin. Compared to other VEGF receptor TKIs, cabozantinib does have a moderate incidence of hand-foot syndrome in particular, as well as a moderate incidence of elevated liver function tests. And all TKIs have these side effects, but these two in particular can be seen a bit with cabozantinib. That being said, despite the cabozantinib toxicities, about half of patients were able to remain on the starting dose of 40 milligrams daily, whereas the other half required a dose reduction for cabozantinib. In thinking about the nivolumab component, this is of course a PD-1 inhibitor, and immune toxicities that are common included also diarrhea or colitis, hypothyroidism or thyroiditis, as well as hepatitis and rash and these other end organ immune inflammatory toxicities. Nivolumab toxicity led to systemic use of corticosteroids in about 20% of patients and was lower incidence compared to combination immunotherapy such as ipilimumab and nivolumab. In sum, Nivo-Cabo was a regimen that has similar toxicity to other IO-TKI combinations and similar to sunitinib overall in the toxicity profile, looking at the grade 3 toxicities. And what's encouraging is that despite these toxicities, cabozantinib and nivolumab actually showed superiority for quality of life, showing that patients can manage these toxicities with expert guidance from their oncologists. Thank you.